Hello, I'm Dr. Tony Clark. I was a consultant at this hospital for 30 years, and of half that time I was the medical director. I also ran the rehabilitation unit and did various other things. I have to say that when I first walked through the door about 3 years prior to me getting a post here, I never dreamt that I would then come back 3 years later and spend all that time here. It's an extraordinary hospital. It was one of the smallest hospitals in the country, and when we became an NHS trust, we were the smallest trust that got that privilege, and we had a turnover of, at that point, £4.2 million, when people like up in Leeds were £190,000 million. So what was it that was about this hospital that was so special? Well, quickly, and most importantly, it was the patients. We had a wonderful group of patients, over half coming from outside the immediate area that the hospital sits in, and many of them having suffered years and years of pain and disability. And with the skills that we had, and that includes the nurses and what they were able to tell the patients, physiotherapists who taught them the exercises, the occupational therapists who gave them the gadgets, and the doctors who gave them very early on some of the newer medicines that have come on into the game, and who have made a huge change in the way that rheumatoid arthritis in particular has been managed. So the patients have always been at the centre of what this hospital has done. It also had, however, a lot of interest in research, and that's why we got our hands on the new drugs earlier than most other people. And we tested them out and we said, yes, these drugs work. And it was having a group of patients who trusted us, who enjoyed coming to see us, and who were prepared to take part in our research that made the big difference. We also were very lucky in having up at the Royal United Hospital one of the finest orthopaedic departments in the country, and again we were able to do some of what in my mind were quite remarkable things to people who literally came in on stretchers and walked out. Mind you, they stayed at the hospital quite a long time, some of the patients, and the standard length of time when I came in the late 70s was over 3 weeks. Now, if you get rheumatoid arthritis and you need treatment, you come a couple of times to outpatients and then you do your own treatment at home. So it has changed somewhat. But what never changed was the real feeling that we were dealing with people who needed help and who believed in us. And we had fantastic teams, fantastic team groups who came together, and it was really not the doctors telling the therapists what to do. It was the therapists saying, I think, having seen this patient, this is what we ought to be doing. And it was that teamwork, coupled with the inquiring minds of all the people who came to work with us, that made all the difference.